In his new book, The 60% Solution, Rethinking Healthcare, author Todd Furniss breaks down healthcare problems and solutions to free the industry to do its job. There are 5 major constraints: poor use of primary care, inconsistent accounting and incompatible IT, hidden pricing, restricted health savings accounts, and hyperregulation.
Hi, my name is Todd Furniss, and welcome to today's Thursday Brief. In today's Thursday Brief, I want to address the importance of preventative care in reducing healthcare costs and improving quality of life for all Americans. The best way to ensure proactively the health of a population is by emphasizing primary care. Keeping a nation healthy is a joint responsibility, and in many ways, it's a team effort. Population health begins with effective primary care, which is proven to save time, money, discomfort, and lives. There are 3 major issues in primary care as it exists today. First, an undersupply of primary care physicians. We have too few of them. Second, too little training on the fundamental aspects of human health, such as nutrition, sleep, and exercise. And then third, an overemphasis on treatment or fixing the problem rather than prevention. We need to create more primary care physicians and equipping them with broader education and greater use of technology. We also need to equip them with more support staff and enable people to take on more responsibilities as nurses. The lack of primary care physicians in the United States is detrimental to accessibility and to quality of care. This is especially true of access to physicians of color and clinics in communities of color. I advocate for physician demographics that mirror those of the patient population, which has historically led to improved health outcomes. We must ensure that our primary care physicians are provided with the education to care for patients' primary needs. Concrete aspects of individual health include things like consuming a balanced diet, prioritizing the 7 hours of sleep, and engaging in regular exercise. However, American medical schools include too little information and research and even education and training on these fundamental aspects of human health. Sadly, we are under-equipped and ill-equipped for some very basic information. The 60% solution prioritizes these major facets of health in medical education in place of outdated electives. Our health system overemphasizes treating patients after health is diminished rather than health promotion and disease prevention. We treat primary care physicians as gatekeepers to seeing specialists for concerns rather than as qualified caregivers themselves. In other words, why can't we train them and equip them to be at the front end of the sphere? We must establish norms and expectations for how individuals should engage with their primary care provider. Primary care providers are those physicians with a direct and personal relationship with the patients. And ideally, they should have a longitudinal data supply with regard to each of those patients. They are responsible for the health and care of their patients using those data sets to the benefit of understanding the patient's environment, including their community, and the local resources available to solve the patient needs. It is suggested that patients visit no less than once per year and form long-term relationships with their physician. I actually would advocate at least twice a year. These relationships facilitate continuity of care and would facilitate the possibility of effective health monitoring. That allows us to get ahead of problems rather than only be reactive to them once they manifest. These changes would allow more health issues to be addressed earlier, interrupting the need for specialists or advanced care, or altogether preventing it, and reducing both individual and collective costs. I discuss more about the importance of primary care in chapter 1 of my book, The 60% Solution. I encourage you to pick up a copy of that today at www.rethinking.healthcare or on Amazon. Thank you for your time today.